So many women are having their ovaries removed, and they don't realize that it can increase the risk of all-cause mortality, including coronary heart disease and lung cancer, and increasing significant risk from a stroke, increasing risk from dementia, even if you take out one ovary and you keep the other one. Now, I can see in situations where you have cancer, breast cancer, to take it out, but I'm talking about the cases where you don't, okay? Let's say you have fibroids or excessive bleeding, and you're going right through menopause, okay? And let's say they take out the uterus. Keep your ovaries as long as you can. Why? Because 50% of all the circulating androgens postmenopausal come from your ovaries. So when you actually have the situation where you don't produce these hormones, it creates a lot of problems. So then the question is, let's say you have a fibroid. What do you do for that? Well, fibroids are tumors. What makes a tumor grow is anabolic hormones, okay? Androgens, insulin, cortisol, estrogen. This comes from stress. This can come from your own fat. So if you have excessive amounts of fat, your body can turn your androgens into estrogen. What triggers insulin? Refined carbohydrates. What will increase androgens? Insulin, coming from refined carbohydrates. So if you did a healthy keto diet, which is low carb, I put the link down below. I also recommend you avoid dairy because there's anabolic factors in dairy. And you do a lot of cruciferous to kind of balance this out. That would be the best approach to help you with the fibroids. So the point of this video is to acknowledge, yes, removing the ovaries does reduce the risk of certain types of cancer, but it gives you a bigger problem, increasing the risk of all-cause mortality. So unless you absolutely need to do this, save your ovaries. Thanks for watching. So if you're enjoying this content, go ahead and share it with someone that could really benefit from it.